special guest in studio. You're thinking about, that time of year. Every 6 months, you need to take care of your dental stuff. Why not choose A New Smile Dental Group? It's over there on the corner of Camp Plenty and Soledad. You can give them a call anytime. Well, maybe not anytime. Well, yeah, anytime. Let's go anytime. 251-0480. I have Dr. Lila, and she joins us right now. How are you?
I'm great. How are you?
I'm doing well. Appreciate you stopping by.
Thank you for having me.
And you guys are over there where we used to be.
We are, yes.
Yeah, there's a giant apple outside of the that you can't miss if you're driving down Soledad.
There is a giant apple on our door.
Yeah, and you hear the commercial. It's one of my favorite commercials of the, you hear the person biting the apple, and then we talk about it. Yeah, so listen for that too. But you are a dentist.
Correct.
And what made you want to do dental work? This is one of those things that I would never want to be a dentist. I would never do it.
You would be great at it.
Would I?
You would be.
Okay.
So part of it is the fact that you have to like people.
I like people.
You like people. You have to want to help them. You want to make a change in their life, make an impact. And you kind of have to like science and arts.
And so what made you choose dental work as opposed to, because it's med school, right? That's how it is at the beginning of dental school.
At the beginning, we go to school with medical students.
And so what made you want to choose to be a dentist?
Because you get to have this interaction with the patients. You get to know them. You get to visit them. You get to spend more time with them. You become a member of the family. It's an intimate relationship when you allow someone to go inside your mouth. It's very intimate, and you have to trust that person.
There is family that I don't see every 6 months. I only see them once a year. So,
but you see us every 6 months.
I see you guys every 6 months. Okay, so I used to get my teeth. I've lost one tooth naturally. As a baby teeth. Yeah, my baby teeth had roots, which isn't a thing, right?
The roots get absorbed by your adult teeth. Yours did not.
Not.
You wanted to visit the dentist and have us do the work for you.
One time I got 5 teeth pulled at once.
But they were baby teeth. They weren't real teeth.
Yeah, I know. It's still gnarly. I was a young child.
But they're going to come out anyway.
Yeah, no, I got you.
So you have adult teeth to replace them. But having your adult teeth taken out is a more traumatic experience.
That's a good point.
We don't want that to happen ever.
Yeah, and so let's find out ways that we can prevent that from happening. We got Halloween right around the corner, the candy capital of the year, right?
I love Halloween. That's my favorite holiday.
That's job security for you, right?
Not quite. I love Halloween because I like pretending to be other people.
Oh, okay. All right.
But I don't think Halloween should be looked down upon as a, job security for us, because you can have anything you want. You can have sweets. You can have pretty much. It's how much of it you have and how often. If you want to have sweets and you want to have a whole bag of candy, go for it, but have it in one sitting. Yeah. Sit there and eat it all.
And okay, so let's actually, I do want to talk about this. What is the worst candy for your teeth? Is there anything that's more?
Anything that's sticky.
Okay.
And actually, there's a lot of things that you think that are good for your teeth. Raisins are really bad for your teeth. They stick to your teeth. They sit there and they're sugary and they stick to your teeth. So that's really bad. But people think of it as a healthy snack, and we don't. We don't like it.
So anything that's sticky, so even if you think it's healthy, if it's sticky, it's probably not that good.
Exactly.
Question. If we like raisins, if we like candy, we have some candy, what do we need to do?
Enjoy your candy.
Okay.
Enjoy it. I am a big advocate of enjoying food, enjoying life. But make sure you have it sit down, enjoy the raisins, enjoy the candy, and then be done with it. Brush your teeth. That's pretty much all I recommend. Don't graze on it all day. Don't have like a couple of raisins here and a couple of raisins there, and all day have the sugar exposed to your teeth all day.
Now, luckily, we're speaking with Dr. Lila, by the way, from A New Smile Dental Group. They're over there on Camp Plenty and Soledad. You can go to anewsmiledentalcc.com for more information, or you can go to 251, give them a call, 251-0480. Now, luckily, I have a wife who is a stickler about making sure that I brush my teeth. For somebody that doesn't have a wife like me, what tips would you give somebody to make it a priority to brush at least twice a day, maybe more?
Twice a day, 2 minutes a day is our guidelines.
Okay.
Every day, people come to us and tell us, we really don't like the dentist. We love you, but we don't like dentists. If you don't want to see me that often, if you only want to see me twice a year, brush your teeth, floss your teeth.
That's a good point.
Otherwise, hey, I would love to see you guys have cavities and see you guys and take care of them. But that's the main concern. Little things we can take care of really easily. If you don't visit us every 6 months, even if you don't think you have a problem, even if there's nothing hurting you or bothering you and everything looks fine, there are things that we see that you can't see, you don't feel. You're not in your mouth. You don't know what's going on. So it's better to come and visit us twice a year so we can prevent stuff.
So what happens, give people maybe some perspective here. What happens long term if you don't take care of your teeth?
If you don't take care of your teeth, you're not going to keep them. So that's pretty much the basic end root of it. And if you've ever seen anyone who's older and their mouth is collapsed, their entire face is collapsed, it's because they lost their teeth. Your teeth help keep your jaw, your bone structure, your entire facial structure in place. So if you don't take care of them and you lose your teeth, your jaw is going to collapse.
No kidding.
And it's going to cost you a lot to replace it. You're never going to be as happy as you are with your natural teeth. So take care of them in the first place.
Take care of them. Okay, so why, Dr. Lila, why should we go to New Smile Dental Group instead of a different dental place?
There's a lot of great dentists in Santa Clarita, so I'm not going to say anything bad about any of them because I know there's friends of mine. What sets us apart, or maybe we're part of the group, is the fact that we have the latest technology. We have a caring staff. We have financing in place. We have specialists that come join us and take care of your mouth. So we have it all under one roof. And we will treat you like family. But if you're like your dentist, go to them. Go to any of us. We will take care of your mouth.
That's one thing about like dentists that I've noticed is you guys are like, geez, just, you know what? Come to me. We're great. I will take care of you, but just go to the dentist. Like, just please just go to the dentist. Yeah.
Just go to the dentist because that's a lot of people just don't want to go to it because it is uncomfortable to lay there and have someone you don't know go inside your mouth. We want you to just go and have it checked out. We will take care of you, but so will a lot of other dentists. Our point is to get you to visit us.
I've seen a change. Maybe it's just because I'm a father now, but I've seen a change in, when I was a kid, the dentist was scary for me. I was scared to go to the dentist, but now I see, there's a concerted effort to make dentistry a fun place for children to go, so they have that a relationship and not scared to go to the dentist, whereas before it was fluorescent lights and beige walls and a receptionist with a really thick German accent but now that it's they do their best to make sure that kids aren't afraid to go and it leads to better dental health in the future.
It's absolutely true. The American Dental Board actually recommends taking your kids at 1 year old, which is really difficult for us to see a 1-year-old. Yeah. However, I do understand where they're coming from. They want them to have a good experience. They're coming in, they're seeing that it's not a scary place. Their first experience isn't hearing from their friends on the playground that the dentist did something bad to me or hurt. We want them to come in. It's a comfortable place. They sit down. We make it fun for them. And if they come see us every 6 months, it's never going to be a traumatic experience. It's always going to be a pleasant, fun experience. I enjoy having kids in my office. They're so much fun. I learn something new from them every day.
Dr. Lila, appreciate you stopping by.
Thank you.
Always fun to have you. And I remember, brush your teeth. What is it? Brush your teeth twice a day, floss often, right?
Floss every day.
Floss every day.
2 minutes brushing twice a day.
Okay.
And floss at least once a day.
At least once a day. And do you recommend the sticks or the string?
Anything you use, I am all for it. Get it inside your mouth. I don't care what you use as long as you're cleaning your teeth.
I love it. Dr. Lila, give them a call. A New Smile Dental Group over there on Camp Plenty in Soledad in Canyon Country, 251-0480. Make your appointment today, or you can check them out at anewsmiledentalcc.com. Thanks, Doc, again for stopping by.
Thank you for having me.